I'm going to be a little bit of gloom and doom today. So sorry, we'll just start off that and we'll start talking about, but there's been lots of stuff going on. So what are currently the three most likely places for you to catch COVID-19 right now? So unfortunately for us here in the country, the number one most likely place to catch it and actually die is a long-term care facility or nursing home. And that's starting to get more press now, which I'm actually happy about because I like when there's a spotlight shined on a problem because then it tends to focus people in the political realm of our society to get moving on it. So, but long-term care facilities and nursing homes are under-resourced. They're often understaffed, not always, but often understaffed. There's not been a public outpouring for support. The government's not really paying attention that much to them, and yet they are becoming the number one place in our country to catch COVID-19 and to die of it. So, you know, it's not happening on the government level. If you know that there's a nursing home in your community, and, you know, call them and see if you can help somehow. I got a wonderful note from the folks, the arts folks in Canada today. They put together a whole list of resources that they can bring from the arts community, from sewing, you know, gowns and making masks. And there was a long list of things. You probably have skills that you can contribute to this growing problem in nursing homes and long-term care facilities. So that's the number one place to catch coronavirus and die. The number two place to catch coronavirus right now is meat packing plants. So meat packing plants are becoming, I guess it's the way that people are working close together. They're in close contact with each other. Perhaps it's not just great. I'm thinking maybe the ventilation systems and the work environments are not set up to break the chain of spread. So if you might remember last week, we talked about the Smithfield plant in Sioux Falls, South Dakota. That's up to somewhere like 900 cases in that one plant in Sioux Falls, South Dakota. And there are multiple other meat processing plants so around the country that are actually shutting or seeing large numbers of cases. So I'm thinking that it's something about the work environment. I've never worked in a meat packing plant or been in one actually. But there must be something in that environment that is creating some facilitation of the spread of virus. The CDC went into the Smithfield plant and came out with a multi-page report with many, many recommendations on what to do about the Smithfield plant. So that's number two. Number three of the top three places to catch it are actually jails and prisons. Because there again, it's very hard to do social distancing. There's not enough hand sanitizer or hand washing facilities. People are packed close together. You know, there's not great isolation between cells and the air moves back and forth. So prisons, and there's been some movement across the country releasing criminal low risk cases, but high risk medically cases. So if you're an older person in jail and you have a relatively minor low risk crime, people are being released, which I think is a good thing. It'll do several things. It'll decompress the number of people in prison so that there'll be a little more social distancing. It'll relieve the stress on the prison workers who are actually bringing the infection home to their families. You know, remember, it's not just the prisoners in the facilities, it's actually the staff that's there to support them. And those folks bring it home to their communities. So that's the number three spot. And then just to add a number four, if you want to, there's growing evidence. There's been a couple of studies looking at homeless shelters. Again, homeless shelters have lots of problems with social distancing. People sleep in common rooms, not so good hand washing, not just such good PPE. So I'm looking at the study that came out last night. In Seattle, they looked at homeless shelters and 17% of the people there were positive when they tested in homeless shelters in Seattle. They did a study in Boston and found 36% of people in homeless shelters were tested and were positive. And in San Francisco, where there's a chronic homeless problem, in their shelters they found, in the ones they studied, 66% of the people in the homeless shelters were positive for COVID-19. So that is an issue.